Well, let me also state that this is very intentional because the H5N1 bird flu virus is not actually able to be picked up by humans in a regular scenario. So by putting it with a regular human flu, they are intentionally causing it to create a hybrid virus. And this is how they're going to make the bird flu virus be contracted by the people because it's very virulent. And basically the scenario that it creates is very disturbing. You actually bleed out into your lungs and suffocate on your own blood. Oh my God, what kind of a satanic ritual is that? That's Abby speaking there. That's not in the text. Moreover, it has been alleged that the specific production system which Baxter has developed with the help of the United States government bodies for producing a human vaccination to the bird flu, namely the use of 1,200-liter bioreactors and vero cell technology, could meet the technical criteria to be classified as a secret dual-purpose large-scale bioweapon production facility, in as far as the production process would allow a huge amount of contaminated vaccine material to be produced rapidly. Vero cells are a continuous cell line derived from epithelial cells of the African green monkey kidney used to make live polio vaccines and also to promote the spread of AIDS. The green monkey, also called the vervet monkey, have been used in medical research for decades. Another point to consider is that the work by Jonathan Allen to determine the link between African green monkeys and AIDS shows that over 50% of the monkeys carry SIV, the simian version of HIV, yet never developed the disease. If contaminated material were added to the 1,200-liter bioreactors, it would replicate and infect the entire batch of vaccine material in the 1,200-liter tank. It is clear that Baxter stands to benefit financially from the outbreak of a pandemic through a contaminated season influenza vaccine in late 2009, and that the shareholders will profit directly from this boost. It has been reported that President Obama holds shares in Baxter. Moving on again, evidence from bird flu vaccine trials that Novartis is a dual-purpose bioweapons manufacturer. Novartis, one of the companies tasked with developing a swine flu vaccine by Defendant Health and Human Services, employed fraudulent misrepresentation and manipulated the vaccine licensing procedure to pass off a substance that is a bioweapon as a harmless vaccine for prophylactic, protective, and peaceful purposes when it tested a bird flu vaccine on homeless people in Poland. Novartis's trials of the FLUAD H5N1 bird flu vaccine in Poland in the summer of 2008 resulted in the deaths of as many as 21 homeless people, according to the Telegraph. When damage and injury, however, are listed as the primary outcome, this is no longer medicine, this is murder. Any vaccine for a pandemic influenza should have to be thoroughly evaluated through trials and research to prove its safety, efficiency, quality, and beneficial health effects if a government is going to be in compliance with its duty under normative justice to issue a license for that vaccine. Moreover, vaccines and drugs should have been tested for their beneficial health effects in several clinical phases for safety and efficacy before they can be released to the general public. This is a time-consuming process, often taking years to complete. There is no shortcut to following these procedures when it comes to safety. The doctors and nurses involved in the bird flu trials in Poland are now on trial for having withheld from their victims information about the drug, presenting it instead as a harmless routine shot. Insofar as they have violated the requirement to obtain informed consent, they have violated the medical law. Insofar as their actions led to deaths of others, they have violated criminal law. Again, I'm reading from Criminal Charges Regarding Flu Pandemic as a Biological Weapon with the Intent to Produce Genocide. These are the Burgermeister allegations. I don't know if they've actually been filed, though, because there's no printed receipt or printed timestamp on them. Are the people of the United States going to be forced to take an unproven, untested vaccine, such as the one produced by Novartis, fully licensed, but licensed to cause adverse events, that is to say, to kill and injure? Evidence of the FDA's collusion. There is evidence that the criminal activities of the Vaccine Corporation are covered up by the complicit FDA officials. The New York Times reported that FDA official Dr. Harry Meyer willingly helped Bayer cover up one of the worst drug-related medical disasters in history. Meyer suggested that the issue should be quietly solved without alerting the Congress, the medical community, and the public. When the French government learned of it, company officials went to jail. In the U.S., no pharmaceutical corporate criminals have ever been held accountable nor indicted. Bayer was one of the companies that issued contracts for unknown medical substances to be injected into Nazi concentration camp inmates during the Second World War. The FDA is a government body whose officials must act, therefore, in accordance with the mandate of the Preamble, Constitution, and Bill of Rights to eliminate the risk of death and injury concerning vaccines and other medicines as the Preamble, Constitution, and Code from which all government bodies derive their legitimacy requires. The FDA admits that it knew there were serious protocol violations and regulatory noncompliance by multiple clinical investigators, and that it had no knowledge these problems were ever fixed before approving the drug. However, the FDA is not forthcoming about information that may indicate a von Eschenbach cover-up. Last March, von Eschenbach provided a written testimony to the committee on the events surrounding the Key-Tech drug approval. The committee subsequently learned from an FDA insider and those familiar with the approval that the testimony was not truthful. The committee had recently subpoenaed the FDA records regarding the preparation of this testimony to learn why it was lied to. Back in February of 2007, Senator Grassley informed the House Committee of the extensive nature of the FDA cover-up on Key-Tech, as well as other issues, including the FDA disregard for congressional investigation. Senator Grassley predicted the unethical behavior of von Eschenbach. Evidence as to the World Health Organization's collusion. WHO is currently working with Collaborating Center in Atlanta, the Centers for Disease Control and Prevention, in the United States of America, and vaccine companies such as Baxter and Novartis to develop candidate vaccine viruses for 4 billion people by autumn of the world's population, enough to achieve an 80% reduction in the world's population. There is evidence that WHO itself is playing a role in exposing the populations of the world to the risk of a pandemic virus that could kill billions of people. Baxter had confirmed it is working with the World Health Organization on a potential vaccine for swine flu, as reported in the Chicago Tribune. After 9/11, Baxter helped supply stockpiles of a smallpox vaccine, and in 2003 the company was contracted to develop a vaccine to combat the SARS virus. In 2006, the UK government announced plans designed to inoculate every person in the country with with Baxter's vaccines in the event of a flu pandemic.